Hi guys, welcome back to another video. It's your favorite pharmacist here, and I'm back again with another video. If you haven't already subscribed, please go ahead and click that subscription button, turn your post notifications on, share with your contacts, share with your friends, all of that. So we all know that we're going through a dengue outbreak in Jamaica, right? So I just thought it fitting to do a little video on dengue fever. So the dengue fever is transmitted by mosquitoes. I'm sure most of us already know that. But did you know that it is transmitted particularly by mosquitoes of the genus Aedes? Yes. Now under the genus Aedes, we have different species. We have the Aedes aegypti among others. But we're going to look at the Aedes aegypti because that's the particular mosquito that's causing problems for us here in Jamaica, right? That particular mosquito is widely distributed in the subtropical and tropical areas, which would regrettably include our lovely Jamaica. Let us talk about the symptoms. Pain and other accompanying symptoms that you may or may not experience will include a fever, headache, retroorbital pain. Retroorbital pain refers to pain situated or occurring behind the orbit of the eye, right? A lot of persons report having general body pain, referred to as myalgias or arthralgias. Myalgias will normally involve the lower back, the arms, or the legs. Arthralgias will involve the shoulders or the knees. Persons also report having anorexic symptoms, low feeling, sore throat, nausea and vomiting. Diarrhea is rare, but it's not impossible. So those are just some of the symptoms that you can experience. Usually in severe cases, persons will have hemorrhagic manifestations such as bleeding gums or menorrhagia, so heavy menstrual bleeding or prolonged menstrual bleeding, definitely that's a severe case. In the severe cases, persons will report having severe body pain, right? So severe myalgias, severe arthralgias. So you definitely need to seek medical assistance. It's important to note that these signs and symptoms may appear usually after a 4 to 10 day incubation period. And these symptoms will usually last for 2 to 7 days. Well, let us talk a little bit about the transmission and the incubation period of this virus. Now, an individual with dengue, right? So a human being with dengue is capable of transmitting that virus for 4 to 5 days, maximum 12 days to a capable vector. That capable vector being the mosquito. Once that mosquito becomes infected with the virus, after an incubation period of 5 to 10 days, then that mosquito is now able to transmit that infection for the rest of its lifespan. And its lifespan is usually between 2 weeks to a month. All right, so to the most important area, treatment of dengue fever. Dengue fever is usually a self-limited illness. There is no specific antiviral treatment available for dengue fever. What we recommend is supportive care. Supportive care with analgesics, fluid replacement, and bed rest. Those are usually sufficient. So we want to recommend acetaminophen as the drug of choice for relieving your pain and your fever. NSAIDs, aspirin. NSAIDs are non-steroidal anti-inflammatory drugs, so no ibuprofen, no Aleve, no Advil, none of those. No steroids, no corticosteroids, so no prednisone. You want to ensure that you have adequate hydration, right, and you get adequate bed rest. Now for severe cases, you're gonna need to go to the emergency room, right? If you're having severe body pain or any form of hemorrhagic manifestation, bleeding gums, heavy menstrual bleeding, or prolonged menstrual bleeding, you need to go to the emergency room. Another product that I wanted to highlight to you guys is the pharmacoline flu. The pharmacoline flu, you can definitely use it to help with your symptoms. You want to ensure that you're boosting your immune system with your vitamin C, right? And you drink plenty fluids and you should be good, all right?